Good morning. I say this every time on a microphone. It's very unusual, but good morning. Welcome to our in-person people and our people virtually. A few more stragglers might be coming in, but we'll go ahead and get started. You have joined us to hear a little bit about the evolving care economy, opportunities and pathways for healthcare. And my name is Jennifer Everett, and my co-presenter and colleague, Jeff Hubert, is here as well.
Hello.
So again, my name is Jennifer Everett. We're with Local Workforce Area 1 up in Lake County in this great state. It's a little bit of a drive, but it's lovely here. Been a program manager with the organization in that role for about 20 years. And prior to that, I was frontline staff. We've changed our name many times. I think we were called case managers before career specialists or career coaches or whatever that is. Can I get hands of how many folks in the room are Title I, just so we know many of our fellow Title II? Okay, 3? Oh, nice. 4? Okay. Employers? There was some in 1 or 2 of my sessions. Jeff, would you like to come and introduce yourself?
Good morning, everyone. I'm Jeff Hubert. I'm the Business Service Manager for Lake County Workforce Development. So looking forward to presenting to you today. I just finished a presentation in this room, so I'm very comfortable here. So thank you for joining.
Thanks, Jeff. So with our agenda today, Jeff's going to go over some of, with his team, business services, how they engage with employers and stakeholders in the space of healthcare. And then I get to share an exciting program and project that part of my team's been working on over the last few years called Inspire Nursing Program. So we'll go over some of the program overview, key partners. I know we've heard partnerships before, and that is definitely something that we all know is critical in this day and age, and it has been for a number of years. But we look at what we do more so as the collective impact in the system and more as a system and not just stand alone and stay in our silos. So that's an ongoing journey that we work on. We'll look at the components of the program of Inspire Nursing, lessons learned. There's been a lot of them. And then some summary and outcomes. We will have time for questions. And I was sharing with Jeff, I think you're going to like us or enjoy this presentation the best because we're going to try to wrap up early. Don't tell anybody. Okay. Jeff.
Our business service team plays a key role in connecting the dots between employers and job seekers. We also work closely with our other departments, our youth team, our career services side. We focus on creating smart, responsive workforce solutions that support both sides of the labor market. We act as a bridge, helping businesses find talent they need while also making sure individuals have access to the training and support to succeed in today's economy. At the end of the day, our goal is simple. We want to help businesses grow and people thrive. We want our communities to really feel an impact. And that's how we contribute to the broader economic growth of Lake County. You're going to hear a little bit about economic development. This is what really keeps our communities thriving. We're putting dollars into people that need those dollars, that are spending them in our county. One of the first tools we use when connecting with employers and community-based organizations, training providers, is our value proposition statement. It's a clear, simple way to explain who we are, what we do, and how we can help, especially in a space and Jennifer can attest to this, that's full of jargon and acronyms. The document we use is especially helpful in opening doors with C-suite executives. It helps us get into the room with decision makers and align early on to get full buy-in across the company. We want C-suite buy-in. We want the owners of the company. We want the presidents of the company buying in. That way it's a company-wide initiative. It's a company-wide partnership. To make our message more accessible, especially for small businesses, our partners are new to the workforce system. So we've organized it into 3 pillars: workforce solutions, work-based training, and a workforce ecosystem. I just want to touch briefly upon the paid work experience. We often describe a paid work experience as a 5-month job interview. And this is key to getting people into the healthcare. Some people are career changers. Some are just out of school. Some are still trying to figure out what they want to do. So we want to expose them to the healthcare industry. We cover 100% of the participants' wages for up to 5 months. Our staffing partner, Salem Staffing, handles all the onboarding and payroll. It's a seamless setup for employers. This helped us really streamline our process by removing the payroll part. A lot of healthcare providers require background and drug testing. Our staffing agency will do that for us. We focus on placements that offer a clear career pathway, sustainable wages, and it's an opportunity for mentorship and hands-on training. It's a win-win. Employers fill real staffing needs at no cost, and participants take meaningful steps towards long-term employment. Some of our engagements include, with work experiences and industry exposure, the health department. We place numerous there. The coroner's office. Smaller healthcare facilities like Millennial Beacon, Family First Center, Live Home Health, which is a home health agency, and a Dr. Harag's Family Medicine. We also dabble in apprenticeship. That's a hot word these days. Legacy Healthcare, we're in discussions with them to one of their franchised nursing homes to help create an LPN to apprenticeship program. Part of our strategy and how we engage employers is from sector engagement. We want to hold events where we get like employers in the same room so we can discuss their issues, their problems, what their needs are, get them familiar with one another so they can share what they're going through at the same time. At our last healthcare summit, we had the Illinois Hospital Association, Northwestern Medicine, and Advocate Condell. We had a job fair in the morning and then a summit in the afternoon. Since that engagement alone, Northwestern Medicine provided us with a direct link for workforce development for priority applications. So we've connected with our community-based organizations, our local college. Hey, we have this portal that we can use. If you have anybody interested in healthcare and they see a job at our local Lake Forest Northwestern Hospital, please use this portal where we get one-on-one engagement with one of their HR placement people. So we had 25 employers at the job fair in the morning where we saw 85 job seekers. Another 25 employers joined us for the healthcare summit part. We held this at Rosalind Franklin University. Again, these partnerships, these building relationships with Rosalind Franklin really helped us put this on. They helped us plan it. They helped get employers there that they deal with. Again, some of these strategic partnerships include Rosalind Franklin University, your local community college is a resource, the Regional Office of Education. This is how we get into the high schools. This is how we get high school students into our employers, these healthcare summits. Phase 2 is to meet with these employers and say, hey, I've got a local high school that has 10 people that want to come job shadow. They want to come visit. These, again, they're not, you can't just make an ask. You have to have a relationship to get these kids into those organizations. Again, Advocate Condell and Northwestern Medicine have been key to this program. Thank you.
Okay, so Jeff spoke about relationships. Again, this is nothing new, but because relationships had been established, we were able to launch a project in 2022, 3 years ago. This was an ask of Rosalind Franklin University. They saw a shortage. Well, there's a shortage in healthcare workers, particularly, but this is for an advanced degree in nursing, so it's master's nursing science. And so this is more of a 5-year program, which we're going to get into. But the focus, what they really wanted, was to look at underrepresented communities in our county and look at high school students where there was the most hardship zip code areas. So that was the focus originally. And as Jeff mentioned, the relationships with Rosalind Franklin University, for example, or the Regional Office of Education, our other stakeholders, those have been going on for a number of years. So it was perfect timing when this launched that we could all come together and work to the greater good for this. So it was community focused. What they wanted to do was find young people that would mirror the community, and so that the people they would be ultimately taking care of, that they felt comfortable, and then giving more opportunity than the starting of a CNA, which how this all came about, but moving up that to that higher education. So the Inspire Nursing Program, again, it's going to provide an educational journey, the component of what they call nursing education to workforce pathway. That was new for me, relatively new. But it supports the entry-level nursing careers and then moving into the Master of Science level. Now, we're only 3 years into our journey, so we're going to share what the outcomes have been, again, what we've learned, and how we're making it better and stronger, we think. So again, key partners mentioned, Rosalind Franklin University coming in as this is their brainchild, right? So this is what they want to support along with all the other players listed here. They did get support from one of the local family foundations called the Schreiber Philanthropy, and they did assist with some funding, which I will share. We assisted with the tuition through an ITA. College of Lake County delivered the training, and then again, the high schools were critical for recruitment. We also had strong support from our board. Not only one of our board members, she is a instructor in the area of healthcare at the College of Lake Forest. But it wasn't just her support, it was our entire board as looking at healthcare as the industry sector, how we can continue to work together in our own ecosystems to advance healthcare in general opportunities, particularly to our most vulnerable young people. So in these partner roles, Rosalind Franklin took their charge into the local high schools, and after speaking with them, they were able to get originally 3 to 4 on board that wanted to help recruit young people. So then the high schools, the guidance counselors, and the folks that they met there were able to market and recruit with the young people to try to get a pool to select from. So then Rosalind Franklin was able to bring that pool together, and the great outcomes I'm going to be able to share with you is it started small, but it's getting bigger and bigger. And then Lake County Workforce, so we were brought in to work on to determine if somebody was WIOA eligible and provide case management. As I mentioned, College of Lake County provided the nursing class Monday through Wednesday, and then Rosalind Franklin had their own curriculum on Thursdays. Their curriculum was what some of us know a little bit more of as some of the 14 WIOA elements for young people. So these are just some of the main topics, but this does go into much more depth into all the different areas of wellness and career exploration, financial literacy, mentorship. What they did with mentorship, which was very cool is they're an interdisciplinary, let me say that 3 times fast, university. So whether it's the School of Pharmacy, podiatry, there's a whole lot wonderful things going on over there. So they assigned graduate students to mentor the CNI high school students and come alongside them. So whether that was not the discipline that they were going to end up in, but it was twofold. They felt not only for the young person and the student, but for the mentor themselves, what they were able to learn along the way. This is where Schreiber Philanthropy came into play and helped provide a stipend, so the students got paid for this portion, which helped. I should say these are incoming seniors, so the folks that were recruited and that applied are basically leaving their junior year and then enrolling in this for the summer. So this starts in June, wraps up in August. So some of the program components, as I mentioned, it is a 5-year journey. It's a 5-year trek. So we're in it for the long haul, long term, right? Again, take a high school student, start with CNA, in the hopes that this is just their foundation and that they are going to embrace this, love this, stay the course, and either go to the College of Lake County for their 2-year associate degree, then transfer to Lake Forest College, where they have an agreement or reciprocal understanding there, or they might go right to Lake Forest College for their bachelor's before going on then to Rosalind Franklin for their Master's of Science in Nursing, which again, y'all have to stay tuned because we're not there yet. Okay. And there's that continued support from RFU for the mentorship programming. This happens to be one of the young ladies that graduated last year from the program, giving a little acceptance speech. I think she was their best outstanding student. This is a picture. It's always good to have pictures, right? Because then you know it's real. It really happened. Wonderful young ladies. We've been trying to get males, and we have not been successful yet. But I'm telling you, we keep trying. So in our first, when it began again, 2022, 2023 graduation, we had 9 students that were WIOA supported. We did have one young student who did not meet WIOA eligibility, and that Family Foundation Schreiber was able to provide their tuition for the College of Lake County, which was wonderful. So I think we had 10 graduates in that one, which I'll get to. But originally, so this was a project that I was able to kind of oversee from the workforce area, and I had 3 team members. So first we said, we had 3 high schools, three career specialists. You can each have a school, each work with the students. But we'll get into how we made that a little bit better. The partner communication that we had just was really sketchy, and it didn't work very well because it was really our first time working together, and the students were the ones that were a little confused. We would all be talking to each other, right? We'd be talking to CLC, we'd be talking to Rosalind Franklin. We're trying to onboard the students and meet all the WIOA eligibility, and there was just some things lost in translation. So this was definitely something we knew we wanted to work on. And some of the students in that first year did not meet the state CNA exam. And we definitely knew that had to improve because we didn't want to put our junior college at risk of losing any certifications or any funding because they didn't meet their outcomes for their CNA class. And so that was something we had to talk about. So we definitely debriefed when this came to an end. I don't know where I had a picture of all the young ladies, but there's some of them. 2024, so got better and stronger. We were able to serve 12 students. They are just all graduating this month from their different 4 high schools. So again, outreach expanded to another local high school, and RFU was able to increase that outreach. Screening and selection process was a little bit more standardized to help them. And then CLC worked very hard on revamping the curriculum a little bit to ensure a higher success rate. because they knew they couldn't, be on the bubble of potentially not being successful, but they found that maybe the students needed a little bit more tutoring, or not to treat this group of 16, 17-year-olds like you would adults. So that was a big learning curve for them. And then we decided internally that we should assign one career specialist for the whole caseload of these 12 students. That worked so much better, even though, again, all of our team members did a great job, but then they all had to talk to each other and say, well, how are your 4 doing? What about your 5? What about... And then when we assigned just one, who was actually in this last picture, there's Chris Liskey. She was supposed to be here today too. She couldn't make it. This is her little baby, and she does a great job. But where we're located, we are close to the College Lake County campus, so she would walk over during the week and stop in and say hi to all of her customers, all of them collectively together. So something, even a small change like that, was very impactful for us. So much so that then all 12 passed with A's and B's, but they also, all 12 passed with their state exam. So that really was tremendous. And again, because all the stakeholders really were trying to work together to ensure success, because at the end of the day, right, it's about these young students and what their future can be. So that was a beautiful outcome there. So that was that group. This was last August. So in the front row is the 12 students, and then they're surrounded by all the stakeholders that I mentioned. We have the instructors and the polka dot. We have our county board member, Miss Ann Main, to the side, and then the rest of the team behind them. So yay for the young people. Yay. Clap, clap. So here we are. We are in the throes right now of launching summer 2025. Now, there's 5 high schools involved, right? Because it's a little bit word of mouth too. So then another one finds out and another one finds out. And so they are just, they continue to evolve and get more high schools included in this opportunity. We have 16 students ready for enrollment for next month for June. And we also just changed small things. Again, this is not, none of this is anything new or different than what anybody else is also doing. It's just learning from some of the things that didn't go very well to hope that we can change and make it more successful. So something as simple as Rosalind Franklin having an orientation before spring break, which I'll get to in a second, but they invited us this time. So you had the 3 key partners, RFU, College Lake County, and us. That had never happened before. Something as simple as bringing us all in the same room so that especially not only the student, but the parent could kind of understand what was going on, because they would be so confused. Oh, I think they need to do something at CLC, and then Chris Liskey, our career specialist, oh, I can help there, I can do. So just this knowledge and understanding that these were the 3 people, 3 organizations that are bringing this together, and how we could support them was tremendous. And they held it early before spring break because we needed to be able to TABE. And that was a critical area for us because the students are in high school. So even trying to be able to logistically get them somewhere, or stay open to TABE them and something along that way. So then Chris was able to schedule them all for spring break, and I think they all came but one, so that was wonderful. And what was exciting this year, we've never done before, but again, we're growing. We invited all the recent 12 graduates of 2024 to come and be part of the orientation, and we did get 5. So 5 actually attended, and so then they were able to share their perspective of how they went through it and what they did. And so it was a wonderful peer-to-peer opportunity for the incoming young people, for the outgoing group, and they also assisted with some of administrative duties. They answered questions for parents, and it was just something again simple we have been working on in local area 1 for the last few years is really trying to get the youth voice, right? We know about it, we hear about it, but taking an opportunity where we can, in a space where we can, and bring them back, because who better to share how the program worked for them, what they experienced, was it too difficult, was it hard, what were they scared of, what about their success, but to see that all 12 finished, and then they're the next group, coming up to it. So that was quite amazing there. So some of the kind of the outcomes that we can share, and again, this is still a work in progress, but as I shared some of the high schools that were involved, there's 1 or 2 numbers that might be off here, but I'm going to go with it. 3 to 4 high schools originally in 2023, up to 5, now 6, and they just keep growing. We had a number of 18 was the original group that applied. It went to 30 and now 65, as you would hope, right? Because if you get more high schools involved and more the guidance counselors understanding this opportunity, the more information is going to be shared. So you would hope those recruitment numbers keep going up, and they do. So in that first year, again, it was 9 WIOA enrolled and 1 based on the foundation that was able to cover her tuition in a scholarship. Then we had 12, as I mentioned. Now we have 16 that'll be starting next month. And then again, some of the numbers of the CNA that were passed. And then we moved into that 100% for both the class and the state exam. What was not added on here, in doing a little bit of due diligence on that first group, I was pleasantly surprised. For some reason, I didn't think as many of the young people were going to post-secondary in healthcare, but I was informed that at least 6 are in healthcare from that first group. Now, again, might not be a nursing track, but it's healthcare in general, and Rosalind Franklin felt very, positive about that, right? Because you're not going to be able to force a young person. They're going to learn along the way and potentially at least get a skill of being a CNA that they can also work at while they're maybe deciding to go into a different occupation area or a different career pathway. But that's quite a good number. And then we'll find out now in the 2024 cohort that were seniors that are graduating this month. It'll be exciting to find out how many of them are enrolling in post-secondary and medical field and healthcare. And then of course we've got this group here, the 2025. I feel like I have no idea what time it is, and thank you. Is there a question? Let's get the microphone. I only say that because I can tell you that this is our last slide for the most part in the wrap-up of summary and outcomes. Yeah.
Well, I appreciate it. Okay.
Questions?
When you were just sharing that last slide, the numbers are pretty big with applicants. What's the determining factor to how many? Is it strictly funding out of 65 that only 16 were selected? Can you talk a little bit about how you...
That's a great question. That was actually CLC's number. That's the max they would take for the class. Not to say, though, there is funding that is definitely, it is one of the priorities of our board. So this is an initiative where some funds have been set aside, and those of all of us in this room know that for an ITA around CNA is just a little over $2,000. So it's a very good investment for our in-school students. And so those funds have been set aside to that degree, and I'm sure we would be open to growth if that is something that we can support in the future. And I see our director, she's got the mic. Jen, please add.
Okay, can you emphasize how this CNA portion of the program itself, what this is established to lead to when it comes to education?
So it is definitely the foundation. I mean, in getting them prepared for the nursing, long journey that they're going to have in nursing. But it prepares them. I mean, they get a credential and an outcome at a very young age where they can get into that kind of employment and get connected to different healthcare systems. So that is definitely the foundation to get them ready to go onto this. Does that answer the question? Do you want more?
And so it also is on a pathway
Yes.
with the local community college, College of Lake County, as well as the College of Lake Forest, to pursue higher level education in nursing. They could go to CLC for their RN, or they could go to the College of Lake Forest for their BSN. But ultimately, it's coming back to Rosalind Franklin. This is why they're investing in this program, to get their master's degree. So their MSN is the ultimate goal. So they're investing in this program to build the pipeline into MSN program. And they built their entire nursing program based on this pathway. So this is a new program at Rosalind Franklin. So it's a long-term commitment. And the importance of philanthropy in this commitment, can you speak to that?
Mm-hmm. Yeah, and so again, that partner was on board with them very early stages before we got involved. And it's necessary to provide that support, particularly when we don't know always what the local workforce will be able to do with our funding, but they're there to support. They're there to help with that stipend. So the students are gaining. So instead of them choosing to maybe take a part-time job in the summer because they are 16, 17 years old, it gives them something worthwhile to earn while they're, again, in training and learning. And then just the support of Schreiber Philanthropy coming alongside. And also, I didn't really mention transportation. That's another area too that we have been able to assist with, but also the foundations are there and willing. That's a safety net, right? And a supportive area. We found it was critical. Matter of fact, the funds that went on this, it was heavy for transportation, because they needed to make sure, we needed to make sure, all of us, that those students could get to where they needed to go, particularly to Rosalind Franklin. Some were coming from about 30 minutes out of that location. Some were a little bit closer by, but it was all very creative and in determining transportation, because that was probably one of our biggest lessons learned. I'm sorry I didn't share that. But yes, ultimately, that's what's kind of exciting about this, right? We know good things are happening, but we don't know yet how many of these students are going to end up back at Rosalind Franklin University for that Master's of Science. But the relationships are there, and the mentoring is there, and the connection is there. And so the hope is that while we stay with them for a couple years, Rosalind Franklin will be with them for the whole journey, from the start to the finish. Any other questions?
There's a question online from Corey. The question is, what was it like getting your leadership on board with spending WIOA funds on a project with such a long time horizon?
Oh my gosh, that's a great question. I mean, I think it was really easy. Interestingly enough, our leadership was gung-ho and had been, again, at the tables and in the spaces with these other organizations for years, building other, working on different initiatives together. So when this came up, we got absolutely nothing but support from our leadership and our board to say, we're going for it. And again, I think part of it is the investment is very minimal for the number of students that are being served. And there's so many partners involved on this to assist. You're not by yourself. You're not in a silo. So we all lean on each other to ensure that every part of the outcome, can be met to the best that we can, right? Because the young people are human beings, but we see nothing but, great work ahead here and outcomes. Thank you for the question. It was easy for us, so thank you.
Can you talk a little bit about the continuity of case management while you're going through such a large project with a lot of different partners, and where each of those partners has kind of their own case management team and how they handle things? And so with a team that large, how are you managing who the student goes to for what things, especially across that 5-year period when for WIOA you're probably exiting at some point during that period?
Correct. And great question, Kat. And this was just, again, one of the things that we saw when I first assigned the 3 career specialists to these. I thought, oh, this is going to be great. You can have that high school, you can have that high school, you can really communicate with the guidance counselor. So I kind of decentralized everything. And then as we went through that first summer, they all said, no, this isn't working. And the student doesn't know which one to go to, this one and that one and who, and then points of contact at every organization, who should be that. So it was one of our own when I said, well, how should we, how do you guys want to handle this? And it really wasn't me. It was, the great frontline folks who said, Chris raised her hand. She goes, I love this. I want to do it. And so the other 2 said, okay, we'll do some other things. But then it was a lot of intentional meetings to improve our communication so that to the student and the parent, it looked seamless for them. But for us, there's a lot of meetings, there's a lot of emails, there's a lot of check-ins, there's a lot of things going on to hopefully make this cohesive and successful. But the relationships now are built because, again, Chris had that opportunity now to get to know them better, and it was only her, and then they could each say, oh yeah, you need to talk to Chris about that. It's all that relationship as well. And then Chris has gotten stronger and closer, to our leads at Rosalind Franklin or to the teacher at CLC. So then she can work on behalf of that student if something's going on. So I just think having a smaller amount of folks involved than a larger is going to keep that success for your customer over time. But it will be interesting because you're right, there's going to be a point, the 2023 group is exited for the most part. So now we rely on follow-up and reaching out and talking to Rosalind Franklin about, where they think the student is today and what's going on. I don't know if that answered it exactly, but hopefully. Quality, yes.
One, I love this. I'm doing something kind of similar in St. Louis, but ours is with an adult population rather than high schools. Kind of 2 questions. Are all of those high school students going to one central location for the CNA training? It's not like a high school embedded program?
Right. It's our junior college.
Okay.
It's a great question.
And then second one, so WIOA funds are being used to pay for this CNA, but say that they were to move on to that next, an RN at the community college or, into a BSN, is that something that you guys are trying to find that continuum there, or are they more relying on, Pell funding or other funding there?
Yes, correct. So that also has been built out roughly. We know since our young people are in those hardship zip codes of the underserved communities, for the most part, they're getting financial aid covered for schooling. But that's also where Rosalind Franklin comes back in, and Schreiber Philanthropy and Lake Forest College. There's some potential scholarships. They do want to assist those students. So I don't have all the details, but that wraparound is there for them if they need it. But it is, as far as the WIOA commitment, we are doing the CNA and the transportation in the beginning. Is there any other? You've been such a good group today. Kind of quiet, but good. Nobody's fallen asleep that I can tell. Anybody else? Go ahead, Teresa. She doesn't really need a microphone. She's got a good, strong voice.
So we are looking at building more of an incumbent worker process in our local area. And what we're finding, particularly in our more rural areas, our community college has an outpost in a more rural area, and what we can't get are CNA teachers.
Oh.
I mean, is anybody else?
We have way more people wanting to do programs than we have instructors to teach
Okay, so it's not just us. Okay, good. Good. Are you seeing that in Lake County at all?
Yes.
Jen's seeing it.
Yes, at the college level, at the community college. Definitely manufacturing.
Well, that-
a shift with, different
Yeah.
industry, definitely seeing
Yeah.
manufacturing. Yes, in healthcare at the community college. And, Rosalind Franklin, again, they just built their nursing program. So they're pretty established with their instructors right now. And they are, but it is the community college level we're seeing, yes.
One of the ways that we're trying to compensate for that is, so we're working with a local community hospital. Not a chain, not a, and we are looking to develop an internal instructor with them, where we will pay for her to get her certification for teaching. And then we are trying to work a deal out with them to use her time to take current folks who are in a non-CNA and say, okay, now you've got an instructor on staff. Let's build your program, but it's difficult for a lot of reasons. I mean, you're taking that instructor off the floor. You're wanting. I'm sorry, they can't hear. Who?
No, let me take this over here.
We've talked to multiple hospital systems about that, and all of theirs is we're not staffed enough to take that person's time away from what we currently have them working on. Like it's just incredible. Even with, we've got BJC down by us and, massive system, and yet they struggle to swing it. And, they have 3 community college districts that really service BJC, and it is still not even coming close to scratching the surface, let alone WashU, SSM, the other kind of large ones we have in the area as well.
So if you come across anything, earth-shattering to overcome that obstacle, let me know. But I'm glad you guys aren't seeing it.
Well, not as much, to that point, but our numbers aren't huge at this time, but there is a shortage everywhere with that. But I think you're absolutely correct to go to the employer themselves.
So we're also looking at, there are some school nurses in our area that are looking at getting certified to then have it more school embedded. That's, a little bit more of a process for the school to figure out logistically, and each individual school district has a different thought process on if that's a good idea or not. But that's when we work with a special school district to St. Louis County. It's a pretty big district, and they do a lot of CTE programming there. And that's something that they've been working on, is how can they pull their, both from St. Louis, or the special school district, but also from St. Louis public schools. They have quite a few healthcare workers within the system. How can we get them certified to teach? But easier said than done.
A page from our online viewers noted that they've created in-house programs for HCT, CMA, and other roles with hired trainers to get people certified. So
Nice.
that is happening in other places too.
Yes, that's excellent. Anything else?
I think that's a wrap.
Well, thank you so much. Oh, wait.
Where is Lake County? Have you developed a robust healthcare sector partnership group?
Yes.
Okay. That's what we're.
Yeah, this is just one illustration of one of the small projects that we're working on. Again, Jeff and his team, I think really our annual health forum has just been so well received, and bringing in more partnerships, which then allows more opportunities for our job seekers, and partnering and internships and work-based learning, and more of these things to just keep growing.
Are you considering expanding this to other training disciplines within healthcare?
Well, in general, we've always supported every level of healthcare. We haven't typically done a lot of cohorts this way. We used to do more out-of-school youth programming, definitely, where there was cohorts, worked with First Institute and their medical office assistant program over the years, building in work-based learning potential and opportunities there. So I think it sort of evolves and changes in different ways. Yes,
So
Jennifer.
based on the data,
Yeah.
right, so this was a shortage of RN, and then what our hospitals were saying, the MSNs, right? So how do we become part of the pathway to an MSN? We are working with hospital systems internally to build up entry-level jobs in the hospital. We haven't finished this process, right? But entry-level jobs in the hospital to create a pathway within the hospital. We have worked with hospitals to create pharmacy tech programs. We're a very heavily concentrated biopharma area. So we've worked in that space too. What we get into a lot of times, and the challenge with definitely the hospital system, is the legal end. So then we start all over in trying to build out a different pathway that can get through those legalities. But yes, we see the shortage across the hospital systems, and we have built those programs. I can give a huge shout out for our Lake County Health Department that has been at the table with us for the last 12 years building these programs. And they start at the entry-level job, and they have brought in a number of interns in entry-level jobs in healthcare. And then they continue on in healthcare education through additional programming we have. But yeah, our health department has used our programs to build up their workforce and then help fill the workforce outside of the department itself.
One more here.
You've got some active online folks here.
Yes.
So Kinda shares that she was a licensed nursing home administrator in a central Illinois rural area. They developed an in-house program to put in-house dietary housekeeping activities staff through a CNA program with their own CNA instructor, and then sponsored CNAs through nursing school, LPN and RN, in return for a 2 to 4 year work commitment.
Way to go. It's a great model. I said I was going to get you guys out early, but actually, everybody's engaged. Anything else? Well, thank you so much. We appreciate it. And best of luck to everybody. I know everybody's working hard in this space in whatever industries you're focused on. But as Jen mentioned, this is really something we take a look at, year after year, where do we need to, where are our efforts most needed, and how can we assist with that, knowing that healthcare in general is always going to be a need. So we'll stay there.
Thank you.
Thank you. Drive safe whenever you all go home.